Good day, this is Samantha Taylor from Group 5, and I'm going to perform preparing a sterile field using a commercially prepared sterile kit or spray. The purpose of this procedure is to prepare the sterile field following the sterile technique, and the equipment needed are the sterile kit, commercially prepared sterile kit, the normal saline solution, the sterile kidney basin, and the sterile balls. So the goal of care of this procedure is that the sterile field is created without contamination, the contents of the sterile package remain sterile, and the patient remains free from exposure of uh, infection-causing microorganisms. So first, for the assessment, we need to gather all the materials needed to save time and effort. We need to check that the package kit, the saline solution, the tray, and the gloves is is not contaminated. It is dry. It must be dry, and we must check that the date of the kit and the gloves and the saline solution is valid, meaning it should be, it must not be expired. Then we need to select a working area that is our waist level, a flat surface, and a clean dry surface, a white surface, like that. And of course, before preparing the sterile food, we need to wash our hands to prevent the risk of contamination from our hands to the sterile field. And we need to inspect all the sterile package, including the date, the appearance. It must be it must be sterile. Of course, it must not have any signs of contamination. Now, for opening this sterile kit, we should keep this beside, and first we need to remove the outer drape of the sterile package, and we need to check and inspect for any signs of contamination, and we need to check if if it is uh, if it is if the date is still valid. Then we need to touch the flap. So this is the flap, as you can see, and we need to uh, reach around rather than over. So we need to pull it and away from us. Open it away from us, then open the sides of the flap the same manner. And last, our in front of ourselves. We must make sure that um our waist and our shirt must not touch the sterile area, the sterile field. So now that we have opened the sterile field, we may now add the supplies, the sterile supplies needed, such as the kidney basin. In opening the package, we must not uh, we must turn on our sides rather than in our front to prevent the risk of contaminating the sterile field. So there, opening the package, making sure not to touch the basin, to prevent from contaminating it. So after I have opened the kidney basin, we must drop it from 6 inches carefully, like that. Like that. And now the gloves. And the OS. In case of misalignment, we may use a thumb to arrange all the sterile supplies, like that. Now that we have added all these sterile supplies on top of our sterile field, we may now pour the saline solution on the kidney basin. So first thing we need to do is to check the label of the sterile solution. It must be up to date, and we need to check the date, the name of the solution, and we must check for any signs of contamination. So like that. Then after that, you may now open the cap of the normal saline solution and place it, and the cap must be placed upside, and we must not put it on the sterile field. So it must be put here like that. Then after we need to pour some some solution on the sink or on the kidney basin. If the solution is weak, like this normal saline solution, so like that. And now we may now pour on our kidney basin. It must be poured 6 inches above without uh, any splashes. Pour carefully, so like that. Then recap the recap our saline solution, and we must label the solution, the date we have opened it, and the time, and like that. So now I'm gonna label the today is May 25, date opened at 10 p.m. So like that. And face it this side, the surface. So now that we have poured the sterile solution, um, we may add any additional supplies on the sterile, like, and we must wear then our sterile gloves before starting the procedure. So now I am through with the preparing this sterile tube. Thank you.